Good afternoon. I'm Shannon Nutson at Indiana State University. We're doing a health presentation on childhood vaccines, why we should vaccinate, for our community health class, Nurse 444. The learning objectives for this presentation are: what are vaccines and why is it important to vaccinate? We'll take a pretest. We'll learn how vaccines work. Why is it important to strengthen our immune system? What is the recommended vaccine schedule? What are the side effects of these vaccines? What are the cost of vaccines? I'll have you take a post-test, and we'll look at the resources that were used to make this presentation. So let's begin. What are vaccines and why is it important to vaccinate? Vaccines can prevent infectious diseases that once killed or harmed many infants, children, and adults. Without vaccines, your children or your child is at risk for getting seriously ill and suffering pain, disability, and even death from diseases like measles and whooping cough. It is always better to prevent a disease than to treat it after it occurs. Vaccination is a highly effective, safe, and easy way to help keep your family healthy. One-time vaccination throughout childhood is essential because it helps provide immunity before children are exposed to potentially life-threatening diseases. Vaccines are tested to ensure that they are safe and effective for children to receive at the recommended ages. Now we'll take a pretest. Down below the video, you'll see a link like this. Click on the video, or click on the link, pause the video. When you're done, come back and we'll finish the presentation. Thank you for taking the pretest. Now let's move on. So, how do vaccines work? Vaccines work by preventing diseases that can be dangerous and even deadly for all infants, children, adolescents, and adults. There are many diseases that are preventable or less hazardous if you come in contact with the virus or bacteria. We're going to talk about three: the polio virus, diphtheria, and pertussis. First, with polio. Polio mainly affects children under the age of 5 years old. 1 in 200 infections lead to irreversible paralysis. Among those paralyzed, 5% to 10% die when their breathing muscles become immobilized. Diphtheria is a bacterial infection spread from an infected person via respiratory droplets like coughing and sneezing. Complications from respiratory diphtheria, when the bacteria infects parts of the body involved in breathing, may include airway blockage, damage to the heart muscle, which is called myocarditis, nerve damage, polynephropathy, loss of the ability to move, which is the paralysis, kidney failure. For some people, respiratory diphtheria can lead to death. Even with treatment, about 1 in 10 patients with respiratory diphtheria die. Without treatment, up to half of patients can die from the disease. Pertussis. Pertussis can cause serious and sometimes deadly complications in babies and young children. 50% of infants will require hospitalization. 1% of infants, children, will die. Teens and adults will have less of a serious illness in this age group, but if they are hospitalized, can cause rib fractures in 4% of the population due to the violent coughing, and 2% will develop a pneumonia. So, why is it important to strengthen our immune system? Immunity is the body's way of preventing disease. When a baby is born, his or her immune system is not fully developed, which can put him or her at greater risk for infections. Vaccines reduce a child's risk of infection by working with his or her body's natural defense to help safely develop immunity to disease. Your child is exposed to hundreds of germs daily. This happens through the foods they eat, air they breathe, and things they put in their mouths. Babies are born with immune systems that can fight most germs, but there are some deadly diseases they can't handle. That's why they need vaccines to strengthen their immune system. Vaccines use very small amounts of antigens to help your child's immune system recognize and learn to fight serious diseases. Antigens are part of germs that cause the body's immune system to go to work. Below is a list, or on the screen is a list of the vaccination schedule for infants. This is started at birth with a hepatitis B virus vaccine. There's 3 in that series. Rotavirus, there's 2. Diphtheria, pertussis, tetanus, 4. Haemophilus influenza type B, there's 4. Pneumococcal, there's 4. The poliovirus, there's 3 doses. Influenza, you start that at age 6 months and do that annually throughout your entire life. Measles, mumps, rubella, there's 2 doses, and that is started at about 12 months old. Varicella, which is the chicken pox, starts at 12 months. Hepatitis A starts at intervals of every 6 months, beginning at the age of 12 months old. That's 2 doses. The human papillomavirus is 2 to 3 doses starting at age 9. The meningococcal vaccine, there's 2 dose series. You start that between age 11 and 12, and then you get your second dose at 16. Your child cannot go to college if they do not have this vaccine. It is required to live in a dorm on college, or to even attend a junior college. They require that now. Side effects of the vaccines, likely any medicine. Vaccines cause side effects such as low-grade fever, pain, and redness at injection site. Mild reactions go away within a few days on their own. Severe, long-lasting side effects are extremely rare. Vaccines are very safe. Costs for vaccines are free for eligible children. It's called the Vaccines for Children Foundation. If your child meets one of the VFC eligibility criteria, the vaccines must always be provided free of charge. Medicaid eligibility, if you're on a state Medicaid program, free vaccinations for your children. Uninsured, a child who has no health insurance, free coverage for vaccines. American Indian or Alaska Native is defined by the Indian Healthcare Improvement Act, free vaccines. Uninsured children get free vaccines. The VFC vaccines can be administered by any enrolled VFC program provider, private doctor, private clinics, hospitals, public health clinics, community health clinics, or even at public schools. So let's take a post-test. Pause the video. Click on the link below. When you're done, come back and we'll look at the resources that were used during this presentation. Thank you for taking the post test. The resources used was the cdc.gov vaccines and the World Health Organization topics under the different types of bacteria and viruses that have been eliminated by the use of vaccines over the years since vaccines have been invented. Thank you for watching my presentation. If you do have any other questions about vaccines, please make sure you're looking at a credible source. There's so much misinformation available to the public regarding vaccines, and it is very important to vaccinate your children And remember that this can be free of cost to children, teens, adults, and the elderly that are required to have any type of vaccine. Thank you.